Hey everybody, it's Dr. Nelson. I'm going to be going over the traction protocols for our clinic here at Advocate Wellness. So we're going to be covering both the general ideas here briefly and then talking about some of the specifics for cervical and low back traction. If you watched the previous video, I hope you had questions about it. It was not a perfect instructional, none ever is. If you do have questions about this one, please leave your thoughts or comments below. If you're watching this and you're not a member of my practice, welcome. Thank you so much for watching my channel. I hope this is helpful information for you. Please understand that this is general information on our traction protocol and may not be indicated for everyone in the general public. If you have questions, again, leave them in the comments or reach out to our office. We'd be happy to gift you a free consult over the phone to see if this might be a solution for you. All right, diving right in, we're gonna start with the general idea of traction. The idea basically is to help open up the joints so the nerves between them can freely communicate with the organs and with the other parts of the body, and the body can send the correct sensation back up to the brain. It's a two-way highway. With inflammation present, that communication is muddied. It's like a bad phone call. The phones work, the network works, but the connection is bad. So we need to clarify that connection. If there are joints that are so inflamed and the muscles are so tight and those nerves are so inflamed, it creates a little bit of a cycle to where it really becomes problematic. And the best tool to help break a cycle when it gets to that point is actually not a chiropractic adjustment, which you might expect to hear a chiropractor say, hey, this is the best thing for you. The combination of the adjustment with the traction therapy at home has worked wonders. And it's one of the reasons why here at Advocate Wellness, our protocols are so successful with helping with severe neck pain, severe low back pain, sciatica, headaches, shoulder pains, everything running down into the shoulders, the shoulder blades, running down the legs to the knee, to the feet, to the toes, all sorts of uncomfortable things there. A lot we can do to help that. And this is a big part of the reason why, and a huge reason for the care savings that our patients experience, because we empower you to do at home what you can. Saves your dollars, saves my thumbs, and all of our time. So I figure that's a fair trade. All right. What I want you to think of is that we're going to combine temperature therapy and traction. You might be familiar with another video of mine on how to use hot and cold to decrease inflammation. And you start out by heating things, you let it cool off, then you chill it with an ice pack, and then you let it warm up again. And you can repeat this for as long as you want. So heating pad will help warm things up. And then here is where you're going to do your traction once everything's nice and warm. If you think about silly putty, if you stretch warm silly putty, it just opens up. It's very, very willing. But if you try and stretch cold silly putty, it's more likely to break apart, and the same is true of your body. We want things warmed up before we stretch. Sports medicine has really borne this out to be true, that you want to warm up first and then you want to do stretching. So we're going to apply the same to the joints of your back for your best results. Now, once that's done, you've drawn in all of this blood flow. It's opened up your blood vessels. It's opened up your capillaries. We've opened up the joints, and it creates an area of negative pressure, which is, again, what we want. We want to help gently tug on things. We don't want anything too intense. Now everything's going to be hot and full of blood and lymph. We don't want to leave it all sensitive and full and inflated like that. Things would be very sensitive and could lead to long-term problems with that. So what we want to do is now we want to chill it with a cold pack. Anyone who's been in my clinic and has done traction and forgotten to use the cold pack afterwards can speak to the fact that their pain is sometimes worse even while they're getting better because they forgot to flush the inflammation out. Inflammation is just a German word that means inflammen, which means on fire or warmer, hotter, like that. A lot of old words for medicine come from a more German Latin root of things. So you don't like to be left hot and bothered, so don't do the same to your back. Yes, it's a joke, it's funny. All right, don't get mad, just laugh. Okay, awesome. Dad jokes will continue until morale improves. So heat for 10 minutes, traction. This time span will vary a little bit. We're going to start easy and we're going to ease into it. And the further we get into it, the longer the time will be. Cold pack for 10 minutes, and then you rest for 10 minutes. Now, once you're done with the cold pack, if you want to do another cycle of hot and cold, you can after you rest. because we don't want to go from this cold temperature straight up back into the heat. This rapid change in temperature, if it gets too rapid or the temperature difference is too extreme, is a process we call burning, when there's a heat exchange that is too rapid. So that's the reason for the rest between the hot pack and the cold pack, or the cold pack and the heating pad again. Very important, don't turn yourself into a roast beef. Okay, you're lovely, but I want you alive and moving and functioning well. Week 1 of your traction protocol will be 5 minutes of traction, up to 5 minutes of traction. Week 2, 10 minutes of traction, up to 10 minutes of traction. And weeks 3 and 4, up to 15 minutes of traction. Now, why do I say up to? The reason for that is we have what we call the rule of 8. No 8s, no 9s, no 10 out of 10s on the pain scale. When the pain gets that intense during treatment, the body starts to tighten up and starts to protect itself. And the traction is particularly to help relax your body and open up the joints. And if we cause so much intensity, and it doesn't have to be pain, it could just be a very intense feeling, the body will try and protect itself and tighten up into this compensatory curled up little ball. That's exactly what we're trying to undo. We're trying to get people straightened up and relaxed, and those shoulders to drop down and back. We want people to be able to stand with their hips underneath their shoulders and stand tall and proud and comfortable. And that's what you deserve. And this protocol helps people do. So it's very, very important that you understand that more is not better, better is better. So your ideal with this traction particularly is actually to target a discomfort level of 1 to 3 out of 10. People say, well, what about higher? What about 4, 5, 6, 7? You talk about that a lot in your videos. I do, but that's when it comes to muscles. Remember that the traction is for the joints. We don't want to irritate the joints too much. The muscles are much more resilient. They bounce back a lot faster. Joints tend to hold a little bit of a grudge if you piss them off. So I want you to focus on a dull, achy 1 to 3 out of 10. No sharp, no shooting, no tingling, no numbness. If any of those things happen, decrease the inflation in the traction device. I recommend devices that you pump up to increase the curvature in your neck or your low back. If you're a patient of mine, you will have brought that device to the office and we'll have walked you exactly through how to use it so you know how to use it for your body. But if you're watching this, know that you want to keep that intensity really low. Dull, achy type is fine. Again, no sharp, no shooting, no stabbing, no numbness, no tingling, no sensations that go from that spot and travel out through the body as a result of the traction you're doing. If that happens, lower the intensity of the traction, and you'll find that if that goes away and you get back to this dull, achy 1 to 3 out of 10, you can continue up to that maximum time that I recommend here to follow this protocol. At the end of 4 weeks, if you're doing this every day, which you ought to, you can do it twice daily, morning and evening, but not back to back. That's too much. Up to twice daily, morning and evening, at least once a day, every day for 30 days. This protocol shows over an 85% success rate. And with the combination of the heat and cold, I do expect that percentage to go up significantly. So again, leave your questions in the comments, or if you're a patient, please go ahead and send us that question directly. You'll have our contact information. You can call us, you can text our office number, or you can send us an email. And if you're a member of the general public, please comment, and or you can contact us at the office with questions. Again, we'll gift you a complimentary consult. In either case, please like and subscribe. Please follow for more updates. We're going to be consistently putting out more content to help educate you on what you can do at home to empower you to get out of my office, to go live your best life, and to be able to do what you want to and what you love to do with those you love, because that's what truly matters and what you deserve. Guys, thanks so much for watching. I'm Dr. Nelson. Have a wonderful day.